Hello, everyone, and welcome to this technical series on achieving sustainable healthcare waste management. Today, we'll discuss national strategies to improve healthcare waste management. And you can already introduce yourselves in the chat and let us know where you're from and your name. We'd be happy to know that. You can also use the chat box if you need any technical support. I'll do my best to help you. If you have any question during this presentation at absolutely any point, please use the Q&A box. It's available at the bottom of the Zoom window. You can ask really your questions at any time, and our panelists will answer them after the presentations during the Q&A sessions. Finally, this session is recorded, and we'll share with you the links to the video as well as the slides. I hope you'll enjoy this session, and I'll give the floor to Lindsay. Lindsay.
Good morning. Nice to see you all here. My name is Lindsay Denny, and I'm an environmental health specialist with UNICEF headquarters. And as Alex mentioned, today's technical series is looking at achieving sustainable healthcare waste management, and the first part on national strategies to improve healthcare waste management. I'll be the moderator for today's session. And first, I'd like to hand it over to Ranjit Deeman, who is the Supply and Logistics Manager at UNICEF's headquarters, focused on healthcare waste management and health facilities solar electrification, to give us an opening commentary about this series. Ranjit, over to you.
Welcome, everyone, and very pleased to start this series of 3 sessions. This is the first of the 3 sessions where we talk about national strategies to improve healthcare waste management, followed by the technology section, which is the second series, session in January. And the last one would be on capacity building around people, focused on people needs and people's training, etc. That this will be in February. So today we talk about what actions we need to do at the national level to initiate the process. Back to you, Lindsay.
Thank you very much, Ranjit, and looking forward to today's session. I'd like to now open it up for some opening remarks from organizations who are here to be supportive of this. Of course, this is a session put on in partnership with TechNet 21, UNICEF and Gabi hosting this session. And so first, I'd like to pass over to Michelle Sadel, Senior Advisor of Immunization at UNICEF headquarters, to talk about why healthcare waste management. Why are we prioritizing this issue? And in particular, Michelle, why are we talking about national actions as our first session? Over to you.
Thank you very much, Lindsay, and good morning, good afternoon, good evening, colleagues, wherever you are. So we've seen an expansion of EPI schedules. We've seen during COVID large use and volumes of vaccines. We're also seeing with the reaching of zero-dose populations an increase in wastage of vaccines, both avoidable and unavoidable waste. And it is critical that from a health standpoint, as well as from an environmental standpoint, as UNICEF, we are providing technical assistance in line with international norms, as well as providing practical, relevant, context-specific guidance and examples to countries as well. So within this, we want to stress that this is part of a building block within primary healthcare, and we're looking at healthcare waste management from a holistic point of view. So not just for immunization, although immunization does drive some of the waste at healthcare facilities. But together with that, we're also looking at the primary healthcare needs for energy requirements, the reverse logistics that are required to get the waste from the health facility to disposal sites, as well as getting other health commodities to and from the sites where they are needed, connectivity for health facilities. So really looking in the planning, the broader needs of the health system. And when we speak about this, and I think today we're going to be delving into national planning processes, I want to stress that accountability and governance is so critical and so important. Understanding the processes, the roles, the responsibilities, the agreed budgets, the activities, and regularly monitoring this as well. So, I'm very excited about the series and the actions that are going to happen in countries as well. So I think a very good set of panelists here to provide you with the relevant technical assistance and guidance, and sit back and enjoy, and we'll take some questions later on. Thank you.
Thank you so much, Michelle, and thank you for helping us think about the full picture here when we talk about healthcare waste. I'd like to now invite Shomi Choi, Senior Advisor of Climate and Environment at the Global Fund. Shomi, I understand that you too are thinking about the role of healthcare waste management in your organization and taking it perhaps from a different lens with the environment perspective. Shomi, why is this becoming a priority or an issue that you're looking at the Global Fund?
Great. First of all, huge thanks to Lindsay and UNICEF colleagues and Gavi colleagues for inviting me and our colleagues from the Global Fund to join this important discussion. First of all, the Global Fund has actually huge concerns as it relates to the environmental pollution effects of a lot of healthcare commodities that Global Fund and other partners support and in our countries. For two reasons. First of all, really the climate imperative, waste and associated the whole value chain of healthcare commodities is a huge part of our global efforts to reduce global greenhouse gas emissions. For instance, our colleagues in the supply and operations side, we have recently conducted a whole value stream assessment, carbon footprint assessment of, for instance, mosquito nets that are critical commodities for our malaria fights. We have seen actually in granular details that the value stream assessment of carbon footprint of this life-saving commodities, there is a significant emissions of greenhouse gases across the value chain. However, it's important to look at the detail. Much of the carbon footprint is actually arising from really upstream raw material process, raw material extraction and processing. And then end of life cycle waste related underground carbon footprint is actually quite marginal. However, it does account for, let's say, according to our recent sample size assessment, around 10 to 15% of the overall value stream of, for instance, mosquito nets as an example. So it's really important for us to tackle this waste management issue through a holistic approach, especially in our efforts to reduce and limit greenhouse gas emissions. And secondly, also the health imperative, especially environmental health imperative, the impacts and the effects of pollution, for instance, solid waste and insecticide and other waste from other commodities, have direct impacts on the health of our communities that we serve. It's really critical that we as partners support our countries to adopt greener and more low carbon waste management technologies and practices and promote them with the objective of both carbon emission reduction, but also really to protect human health from local environmental pollution from the end of life cycle waste issues. So that these are some of the key reasons why we are committed, and we will continue to support our countries in sustainable and low carbon waste management. And maybe finally, as we have just come back, I just came back from the COP28. You know, COP28 is an important reality check time. Despite the efforts of different partners in reducing greenhouse gas emissions, we are at a stage where, going towards at least almost based on the current business as usual scenario. at least 3-degree global warming scenario, which means most of our countries where we're going to hear from today, for instance, are going to continue to experience widespread, even more negative and severe impacts, especially health impacts from different climate hazards. And waste actually is at the same time is an important lever for greenhouse gas emission reduction, but also an important issue when it comes to actually climate change adaptation and disaster risk management. Solid waste and waste that is not well managed does provide as an obstacle for a lot of cases where, for instance, flooding and local environmental and climate risk issues, and even linked to environmental health hazards, especially in the context of increasing and escalating climate-related disasters. So I think there's an even more stronger imperative now than ever that we really provide coordinated, concerted support to our countries to accelerate this waste management transition. Thanks a lot for inviting us, and I really look forward to learning from all of you. Thank you.
Thank you so much, Shomi, for making us think about the environmental considerations, and really helpful to think about this so topically with COP28 as we think about the role we all can play from the reduction of greenhouse gases with healthcare waste. Really appreciate that perspective from the Global Fund. I'd now like to turn to Dr. Yewande Alimi, who is the AMR and One Health lead at Africa CDC. Dr. Yewande Alimi, same question for you. Why, for you, is this issue concerning healthcare waste management for the Africa CDC?
Thank you very much, and good morning, good afternoon, depending on where you're joining us from. Thank you so much to the colleagues from Gavi and UNICEF for organizing this really important discussion. At Africa CDC, one of the things we are prioritizing is really around infection prevention and control, and most importantly, healthcare worker safety across different healthcare facilities. Like many of the other speakers have rightly alluded to, as much as immunization, vaccinate waste is a big problem, we also have to think about other waste products coming out from healthcare settings. At Africa CDC, one of the things that we have been doing over the past a few months in 2023 is really around strengthening IPC as well as environmental waste management in primary health care settings, primarily because this is where health is closest to the communities. A few things that I really like to highlight, and I'm hoping that over the next couple of months as we go on this webinar series, is really one, like the colleague we just mentioned, climate change. How can we start to ensure that African healthcare facilities are climate smart? And this includes interventions around cost-effective waste management strategies as well as interventions. But most importantly, I think one of the things that I would like to really highlight, and I'm hoping our discussions will really showcase, is that cost-effective strategy. Many of the healthcare settings in Africa have a lot to deal with. There are not enough resources to be able to scale them up to where we need them to be. So we really need to think around innovation that are very context specific, be it at secondary, tertiary, or primary healthcare settings. But most importantly, it's around the behavior change for the healthcare workers. As much as we put all of these interventions in place, there is that social science anthropology bit to handling waste and waste products that come out of healthcare settings. So I'm definitely delighted to join many of you on this webinar, and we're definitely looking forward to the continued collaboration and support for Africa Union member states. Back to you, Lindsay.
Thank you so much, Dr. Alimi. And it's really exciting to hear here also the different perspectives of why this issue is so important. So thinking about infection prevention and control, healthcare worker safety, these are all critical concerns. Lastly, I'd like to turn to Mwenge to talk from Gavi's perspective as to why this issue is concerning for Gavi. Mwenge, are you able to join us?
Thank you, Lindsay. I think it's Dr. Karan Saga who will speak on that.
I don't see him on at the moment, Mwenge, if you want to make a couple points. Oh, there you are. Hi, Dr. Karan.
Hey, I'm very much there. Thank you so much. And thank you, Lindsay. I think, first of all, let me thank you all, UNICEF, WHO, TechNet, and our partners, Global Fund, Africa CDC, for organizing this very timely series on healthcare waste management. And I'm sure the participants who are attending will really be benefited in terms of learning more about why it is important to deal with the healthcare waste management, as well as some hands-on experience to them and interaction through the series and all the technical information that will be provided. For Gavi, it is very important that we remain focused, and as part of our immunization supply chain strategy, we have identified that healthcare waste management is one of the important components that we need to deal with when we are talking about strengthening of immunization supply chain. And the previous speakers have alluded to a lot of the importance of looking at healthcare waste management from the safety perspectives, be it of the communities, healthcare workers, the patients themselves, or the environment. So it's important that we are looking at this from all the angles. We acknowledge that it's a growing concern, and of course, needs to be tackled head on. We've seen firsthand. I have seen myself how healthcare waste management is done, especially at the primary healthcare facilities. Open dumping or open burning of healthcare waste is really rampant across very many countries that we work in. So we really need to understand why this is and how we can address this issue. Gavi has a strong role in, of course, the immunization, but I'm talking more, as Michelle also mentioned, a holistic approach to healthcare waste management. So obviously for us, it becomes important that when we talk about immunization, healthcare waste management, it's all encompassing. And we work in tandem with our partners. We provide resourcing, technical assistance, capacity building, and of course, through our health system strengthening grants and other grants, we are supporting countries to really develop policies and also institute mechanisms for healthcare waste management. But we've seen that although these resources are being made available, but then the impact of these resources is not coming to the fore. So it becomes important that we need to kind of work in tandem with our partners to do this all together. And that is why the importance around collaboration and partnerships is very important. And we cannot do it alone. And I'm really happy that a lot of organizations have come together in trying to address this. And if we are able to do a concerted effort, we will, I think, make a lot of progress on this. Innovations will be very key. We know, I have seen myself that we've been providing a lot of resources for incinerators, for example, but then once they are put, they're not put to use. So we need to really look at, what are the green technologies which are available, and how do we bring in the best innovations in healthcare waste management that is being used elsewhere to low and middle income countries. So it'll be important that we are looking at this. And Gavi remains really committed in terms of advancing this as integral part of our broader mission to reach zero dose, as well as strengthen health systems, particularly for immunization, but of course, for broader health outcomes as well. So I look forward to this series. And once again, a big thank you to all of you, and welcome to the participants.
Thank you, Dr. Sagar, and really love the reiteration here of partnership and collaboration. It's really exciting to hear, from your perspective, head of comprehensive vaccine management at Gavi, looking at it from vaccine perspective. We also have colleagues talking about it from climate and environment and infection prevention and control. So many of us coming at it from different directions, and really critical that we work together to look at safe and sustainable healthcare waste management. So with that, I'd like to open up a poll to hear from you all. There are 80 some of us on the call this morning, this afternoon, wherever you are. So if Sophie, you could launch that poll for me. We have a few questions to better understand where you all are in terms of what you're doing on healthcare waste. So the first question, have you implemented healthcare waste management in activities in your country? And secondly, what elements of healthcare waste management are you addressing, if you are addressing any, whether you're looking at assessments, policies, technologies, capacity buildings, etc. Please feel free to respond. And then if you have any additional thoughts of work that you're doing that's not covered here in question 2, please feel free to drop any thoughts in the chat. But take another 60 seconds to respond to these questions. And that second question is multiple choice. So you could select multiple responses here in terms of the activities that you're undertaking. You might be doing policies as well as technologies. So feel free to share both of what you're working on. And again, those of you who are saying other, very interested to hear what those other activities you're undertaking. Share in the chat with us what you are working on. About 54 of you have responded, 54% of you have responded. So let's just take another 30 seconds and then we can go ahead and close the poll. All right, take the last 10 seconds to get your answers in. And very interesting. Okay, Sophie, if you want to go ahead and close that up and share the results with everyone. Great. So as you can see, about 67% of you on this call have said you're currently working or have previously worked on healthcare waste management activities. Fantastic. That means we have some experienced individuals here joining us today. About 18% of you have not currently done any activities, but you're planning to in the future. So this is the right place to be. That's fantastic. And about 16% of you are not currently or not planning to work on this, but this must be a topic of interest for you to join. And then for the second question, what elements of healthcare waste management are you addressing? It looks like you all are active across the board. 61% are doing assessments or situational analyses. 66% are working on policies and guidance around healthcare waste management. 39% are working on technologies. And that'll be the subject of our next session. So if you're interested in learning more, come back and we'll talk about technologies. 68% of you are focused on capacity building. That's fantastic, focusing on the people element. That will be session 3 of this webinar series. And then a few of you mentioned other. And so I see in the chat, looking at expired ARVs, dealing with waste management treatment for viral load waste. Very interesting. So very specific activities that are underway. So we'll go ahead and stop sharing that. And now I will turn to our presenters now that we've heard from you all. So we have a series of presentations for you today, and I will go ahead and share my screen. And we will hear, again, this is focused on national strategies to improve healthcare waste management. So we're going to start with an overview introduction on healthcare waste management, what it is, why we're talking about it, and then we'll focus specifically on those national actions. We have a case study from Somalia. We're very grateful to have our UNICEF Somalia colleagues here to share about their work. And then lastly, we'll focus on maturity modeling for healthcare waste management and how that exercise can help you drive some of those national actions forward. So first, I'd like to introduce Isabel Canton, who's a healthcare waste management consultant for UNICEF East Asia and Pacific Regional Office. She's been working on this issue for several years in depth with UNICEF and that region, and in particular, will tell us about why this issue is so critical. So Isabel, over to you.
Yes, thank you, Lindsay. So thank you to all the guests and for colleagues to joining us to this first webinar. So this first picture that I'm presenting, it's to remind us that waste at hospital is one. This is one of an example in a low middle income country. The image, it reminds us that we cannot just rest on our liability on addressing only on sharp waste or immunization waste, but the challenge really is addressing the bigger picture, all the waste. Next. So all the sources of waste, the number one waste that we talk about comes from hospital. We have waste coming from laboratories, clinics, and healthcare centers, blood banks, dispensary, and the medical research center. So this is where it comes from, and that's what we consider as components that are called healthcare waste, because often the definition is not clear. There was a study done where in 2019, they said, the climate footprint of the healthcare is about 4.4% of the global total. So if healthcare sector was a country, it would be the 5th largest greenhouse gas emitter on the planet. Next. This is why we have to ask ourselves the question, what can we do to reduce, reuse, recycle, the waste that is creating in our created in our health centers. What are the best practices to manage waste? Next, there are publication and guidance that have been issued globally. So one of the first one being a guide that was issued by UNICEF and WHO in 2021 that was talking about COVID-19 vaccination, supply and logistic guidance. And that section 6 of that guidance, there was recommendation to follow national guidelines and codes for final disposal, and then try as much as possible to reduce the volume of the waste by segregating it. Preferably use best available technologies that are in accordance with the Stockholm Convention, such as all decontamination of waste by autoclaving, microwave, frictional heat, or similar procedure of high temperature, very high temperature incineration. And as well to look at other solution like using reverse logistic to minimize the immunization waste. Next, there was another guide that was published by WHO. It's an overview of technology for the treatment of infectious and sharp waste from healthcare facilities. And then finally, in 2022, WHO published a global analysis of healthcare waste in the context of COVID-19, where they stated that the ultimate aim should be the use of non-burning technology, such as autoclaves. You find that in that section. And then the second important statement was the over time, non-burn technology do cost less. Next. The waste composition in a healthcare facility, 85% of it is general and domestic waste, so not infectious or hazardous waste. 10% of it is the infectious waste, and 5% chemical and radioactive. Next. So when we look at each of these three types of waste, for the general waste, often we have to ask the question, is there any initiative we can put in place to recycle? Some of it can be trash, some can be recycled, like, for example, packaging material, paper, cardboard, glass, and metal. Some can be reused, for example, the electronics or some furniture. Or we can, if it's available in your country or in your area, then composting. So food waste from kitchen services, can be composted. Next. Then we talk about the hazardous waste. So often this is the waste that we find when we do immunization activities. So we find infectious waste, sharp waste, pharmaceutical, radioactive waste, chemical waste, and genotoxic waste. Maybe those last ones we find less in the lower level health facilities. But if you click next, thank you. So you'll see that really those three are the ones that we want to talk about. And this is what we want to focus with this web series. But, and it's all about immunization and the lower health facility waste. So first thing that should happen, next, Lindsay, thank you. It's the legal framework. So how do you start assessing a national healthcare waste management in your country and all the procedure that you have? First, you need to look at the country's legal framework. Next. So the key question to answer is there a national policy on the management of waste produced by healthcare facilities? Is there any policies that's been developed at the regional or local level? What points should be taken into consideration when you're producing a policy? Has any legislation, national legislation, been enacted to control the management of healthcare waste? Are there any practical guidelines for healthcare manager to use locally based on national or international standards? And is there any system of enforcement of healthcare waste laws and regulation? Next. So even if there are no national policy or you don't have any legislation or guidelines, this should not prevent a hospital or healthcare facility from designing and implementing a proper healthcare waste management plan. So first, you need to assess the situation. Then you state the problems that you have, that you're encountering. You identify the stakeholders because there are partners and collaborators out there. You plan and you budget all your action and your future action in the long term. And then you set out simple action. You try to, go for the low-hanging fruits, start small and then build it up and then implement the action. This is how you will get, a plan for the country and maybe even just your region or your health facility. Next. Partnership, who are the stakeholders in your country? There are a lot of people that are looking at healthcare waste management at the moment. For example, at UNICEF, there are 2 sections that are really active in healthcare waste management. There is the UNICEF Health section and you have WASH section. Make sure, everyone speaks to each other. There is Gavi looking at it. We have the World Health Organization. We have global funds. There's Ministry of Health, health and wellness, and there are the Ministry of Environment as well that could exist in your country. They sometimes have different names. It could be climate, it could be environment, it could be green processes, etc. And there are many global humanitarian groups that are looking at it too. So make sure that you try to speak and bring at the table all those partners so that together you can progress in this domain. Next. Then, so this was really the overview. In the next webinar of January 23rd, we will talk more in details about the green and safe technology for healthcare waste treatment, from the selection and procurement implementation. So there is a guide that will be published really soon that will help you make decision on what's the best technology according to a country context. And then on February 20th, 2024, we will talk about facility level activities. So how, you can manage healthcare waste. So I hope you find those webinars interesting. And if you have any other question, we'll discuss them at the end of this presentation. Thank you.
Thank you very much, Isabel. Very helpful to walk through that and help us make sure everyone's on the same page of what healthcare waste is, what we're discussing here, and why we need to address it as we look at these national actions. I'd now like to turn to Ranjit to give us a presentation on these national level actions and what specific activities should be taking place as we look at the healthcare waste management landscape in your country.
Thank you, Isabel. Isabel already touched upon the high-level approach, so I'll just deep dive a little bit into national level actions to give a flavor of the approaches we are offering to the countries, and together with Gavi and Global Fund and solutions we are looking at. Yeah. So in nutshell, this is what we are doing. We want to establish the first thing in a country which is trying to address the healthcare waste management solutions. The first thing we need to have in a country is a committee that steers the actions on waste management. Most countries have healthcare management committees under different ministries, different name, but it needs to be activated with a plan in hand. And then we want to do a formal assessment for a reflection of situational analysis to see where do we exist today in terms of what is the depth of problems, what is the scope. I like the statement from Africa CDC. We are resource constrained, and we want to see what we want to address first, what can be addressed in the given situation. So that situational analysis is a reflection of reality and say where we want to go. of course, then take the next step of plan the solutions customized to the country needs, and with clear actions, budget needed, and timelines. And then we also, as a part of the approach, want to select the appropriate greener technology, which is not carbon emitting. We have heard, and of course everybody is aware, most of the waste is burnt at the facility level, where the treatment is done at the facility end. And we want to replace it with greener technology as a next step and our contribution towards the carbon emission reduction. So the selection of technology with government and their choice. And then we want to establish clear logistics, because these technologies they often come with a price tag, and we want to understand the right size of the technology and location, some sort of hub mechanism where reverse logistics is applied to bring the waste and treat it there and then taken off for offsite disposal. And then the committee must be, as I said, equipped with a plan, and which they can follow and track and take it forward. Next slide. So as we said, there are certain tools available. There's a WHO rapid assessment tool. I didn't mention Gavi's maturity model, because Gavi is going to talk about it a little bit in detail. After this, there's a WashFit tool of WHO and UNICEF, which is for district level planning and health facility level actions. And we have at UNICEF packaged the need of the solutions package for healthcare waste management for countries. And what we have done is we have already applied this package in about 5 countries completely, and another 5 countries are in process of doing the assessment, of course, with the kind support from Gavi on this. And then, so next slide, please. What we do as when we do the assessment in a country and the solutions report, we are looking at these key heads as our solutions head. When we look at regulations and legislation, we are looking at the national environment policies. Do we have the right set of policy to drive the program well? Is there adequate healthcare waste management budget? If not, can we create a budget, and can we create the funding source from various opportunities we have? And this is an important step. And then we look at the training and knowledge of healthcare staff and see if there are gaps there. Do we need what kind of solutions we need to fill those gaps? And then we look at personal protective equipment for healthcare workers. Are they adequately protected at the health facility level? And what else is needed there to support them? Then we look at the quantum of waste generated at the source, and what kind of waste is generated. Is it properly handled, or what is missing? Then we look at the segregation and bins, container, etc., and the practices, availability. Then we look at the movement of bins, where the waste is taken. Is it treated on site, off site? Next slide, please. And then we offer solutions, one of the 3 streams. If the facility prefers on-site treatment, then a solution for on-site treatment is offered. If the country prefers that it can be taken, the waste has to be taken out. There is resource constraint. We have to take the waste out and dispose at some facility. That is also one option, or otherwise take it to a off-site location and treat the waste, and then dispose the residual, essentially recycle the waste, and most preferred option. So those kind of actions are proposed as a result. And then we are also building the database I'm going to talk about, which is very crucial and essential to support countries from here. Next one, please. I'll just deep dive also into what do we do when we do the assessment. The first thing we are looking at is the best practices, documenting the best practices. When we visit the facilities, we look at, in each of the criteria, what are the best practices? Do we have best practices present in the country, and what are the best practices? And we reflect them very well. It's also rewarding the health facilities that follow these practices, and also create a mechanism for government to recognize the actions of the health workers. Next one. Then we look at, let's say, taking the example, I'm just taking the example of regulation and legislation. We look at the current status. I've taken the example of Botswana, where we have completed the assessment. We look at what is the current situation in regulations and legislation. What does the reflection from the assessment says? And what is our target? What do we want to achieve from here? So that is set. Now this thing is set along with the Ministry of Health, Ministry of Environment, and say, look, this is where we are, this is where we want to go. And after setting the target, next step, please. Then we now deep dive into key actions to achieve those targets. So we have set the targets we have seen in the previous slide. To achieve those targets, these are the actions needed to achieve that. So document all the actions. Next one, please. And then the next step is now again look at what are the technologies needed to provide the solutions. Technology essentially in terms of either IT technology or hardware technology, whatever is the technology needed to support this. In this case, for example, regulations and legislation, we might need an online portal where all the documents, policies are accessible to healthcare workers. Job aids are accessible to healthcare workers. Probably a mobile app where they can access the information on as needed. Trainings and capabilities needed to resolve this solutions for regulation and legislation. So we will need to recruit new healthcare waste management personnel to support the program. And what are the financial and needs for capex and opex? So the financial needs in this case is that government of Botswana need to fund the employment of additional staff and in-house web services. This is now designing the system here at the national level. So when we say that we need additional staff, we'd also define what additional staff is needed, what salaries are needed, from where they are coming. All that is documented in there. Next one, please. And then we'll see what is the level of efforts required by the staff personnel, tools and equipment, etc. And then we schedule the actions. So year one, what are the actions we need to do? 1, 2, 3, 4, 5. Year two, next one, please. It's more tabulated. Yeah, sorry, it missed on. And then we also budget, like taking the example of regulation and legislation, the budgeting for the whole country, staff personnel, it required 2.3 million 10-year budget over a period of 10 years to resolve the problem. And so this is how the action plan is budgeted. Now, this is just an example of regulation and legislation, but then we look at the entire sections, all the sections, technology, trade capacity building, PPE, segregation of waste and treatment plants, all put together, we have a national budget. Next slide, please. Yeah, sorry, this is what I wanted to say, that after we budget, we also look at the classification of the budget, where the money is needed for. For example, in this particular case of regulations and legislation, we need most of the money is going for the staff and personnel, funding the positions, tools and equipment, about what is needed for to procure tools and equipment, what is needed for engineering and construction, plant and machinery. So entire action plan is then classified, and then so that we can make a very easy procurement plan if needed, or a recruitment plan, or etc. Next one. And then the entire plan is also classified by year to say that, look, in order to resolve this problem, here is an action. Year one, what needs to be done? Year two, what needs to be done? And it's a 10-year plan. Year three and 3 to 10. What is needed to support this action plan? So it's a yearly plan, and then we track the plan as we go. It's essentially Healthcare Waste Management Committee that tracks the plan. Next one. Globally, this is very helpful. We are putting together a dashboard of actions we have done. Now, as I said, we have completed assessments in 5 countries. Here, this is Somalia and Somaliland split into 2. Tanzania is almost complete. It's coming up. In this dashboard, we are looking at how many waste treatment plants are planned. We can track it up and support countries with investment cases and linking up with donors and say, look, this is the investment needed in this country. These are the reasons. And then looking at these 5 countries alone, four countries, essentially Somalia and Somaliland together, it's about 141 million investment needed already. And then we also look at track. Next one, please. Yeah, various indicators, and essentially this will be open to the countries, those who have done the assessment. This will be the tools in hands of committees which are managing the show, also donors, also us implementing agencies to support and say, look, where we are, how many countries have established committees, and all sort of indicators on this dashboard coming out a result from the assessment. And then we'll be putting together, it's in progress, the action tracker to say that this action has been completed and what progress is made so far. And of course, as in any other assessment, it needs to be repeated once in 3 years to say what is the reflection. And of course, if we have a tracker in hands of waste management committees, we could repeat the show after 5 years. We already are tracking the progress as we go. Next one, please. So these are some of the indicators we are tracking from all the countries where the assessment is done, and really to help out and say, where do we need help here? Where do we need, what has changed? Right now, for example, on the left side, we are seeing what is the quality of waste segregation. Over a period of time, we might see the progress and say, look, insufficient has changed from 30% to 20%, and then satisfactory has gone up. And that is the plan. Next one. Yeah, some more indicators, how the infectious waste is treated on site. So today, this is the reflection. After interventions, what is the change happening? So we're working with Gavi and of course with the Global Fund, all the partners, and of course countries, those who are coming up and helping with assessments. We are working together with them to define these indicators and sharpen it. All this is work in progress. Next one. Yeah, so that's a bit from my side to explain, to deep dive into what is offered today by UNICEF and Gavi, support from other agencies, and say how countries can benefit from. Over to you, Lindsay.
Thank you so much, Ranjit, and great to see the national actions to date. And I actually haven't seen those dashboards yet. So exciting to see the data pulled together and help us think about where the targeted actions are needed as you pull together those work plans and then look at change over time. Sophie, I want to take a check-in. We're halfway through our presentations. Are there any questions that we want to direct either to Isabel or Ranjit to respond to?
Thanks, Lindsay. Yes, we have some questions coming through in the Q&A box. So maybe just to start us off, to both of you, Ranjit, Isabel, or anyone else who would like to answer, what plans are in place to strengthen healthcare worker management committees across different countries?
So I believe I answered that question already as part of the assessment, that we, when we approach the solutions, this is the first thing, and we have engaged the third-party consultants to support countries, and this is one of the functions they do is establish the committee, draw the members from the right ministries and right logistics team, and create the committee, and then plan the assessments with them. But outside of this, if we want to show, we can support. We have the TOR for the committee, and we can support through our country offices establishing such committees.
Great, thank you. Sophie, any others in here? I see a question from Philippe that might be interesting.
Right, yes. So from Philippe, among the many challenges facing the safe treatment of biomedical waste are leadership and funding. Institutional anchoring must be carefully established between the various Ministry of Health departments, such as EPI, hospitals, pharmacy, hygiene, and sanitation. How can a partnership be built and strong leadership ensured? How can the Ministry of Health or others structure be identified to provide this leadership?
Over to you, Ranjit, and then perhaps to Isabel on what partnership or leadership can be ensured with the Ministry of Health and other partners.
Absolutely, absolutely. I think I was talking when my mic was mute. Apologies. It is the committees. I think this is the honest lies on committees, and also the program who's driving the immunization program has taken the responsibility for now to address the whole primary healthcare infrastructure waste solution, because we are one of the most resourced section, I have to say, within the health to reach out to the last mile. We have many vaccination programs going on, including COVID-19, supported through immunization program. So Ministry of Health immunization team or any other team which is leading the action can actually liaise with donors, and to me the answer is having established the committee first, and this committee has the driving force to drive the action, followed by have a nice action plan, country action plan, budgeted action plan, and that will give the material, or the, let's say, the content to substance the actions in the country.
Absolutely. Thank you so much, Ranjit. Isabel, do you have any thoughts on your end about leadership and partnership from your perspective?
Yes, and I think, this is what we were explaining during our presentation, Ranjit and I, is, the first step really is assess the situation. This is part of your first initial assessment. Who is out there working on healthcare waste management? Find a partnership, find the collaborators that are already working on this subject, and bring them all into a committee. And this is, the more partner there is, the stronger the committee will be, and you'll be able to develop work plans. So really, start by assessing the situation.
Thank you so much, Isabel. And I think also we had commentary about making sure that there's focal points within the Ministry of Health. Obviously, that's critical to ensure that there is a point of contact, that this is really rooted within specific individual roles and responsibilities within the Ministry of Health or Ministry of Environment in terms of that coordination. I'm going to go ahead and move forward with the presentations, but keep in mind we'll have a second Q&A session at the end here. So if you want to continue to submit your questions, Ranjit, there may be a couple of specific nuanced questions here for you. So if you want to go ahead and answer those in the chat, you're welcome to do so. But I'd like to now open up for a specific country experience. So we are going to hear from Patricia Darikwa, who is the Global Fund Manager at UNICEF Somalia, on the healthcare waste management roadmap development in her country. So Patricia, over to you.
Good morning, good afternoon, colleagues from wherever you are, and thank you, Lindsay, for the opportunity to present our case in Somalia. I think the last question that has been discussed by Isabel and Ranjit talks a lot to what we had to talk to first is Somalia, but maybe I'll go into my presentation and join the discussion. Next slide. Okay, this is basically the way I'm going to go through the slides, the background, the activities that we've done so far, the task force formation, waste management assessment, our roadmap, technologies procurement, and lessons learned, and the next steps. Next slide. Right. The background to our program in Somalia was basically COVID-19. With the coming of COVID-19, we had support from the Global Fund, where they opened up the possibility of us to be able to actually support system strengthening. And we already knew that with the coming of COVID-19, there will be a lot of waste that needed to be managed. And Global Fund agreed with the government for us to actually put resources for the procurement of technologies for waste management. And the same with World Bank on the waste management. They also realized that with COVID-19, there was need to have more intense investments with regards to our waste management. And then we also had support from our HQ on LTA development. And also thanks to Isabel and Ranjit, we were borrowing from the models that they were sharing today to see how best we could apply them within the country. And the LTA that we had with at HQ level or with Crown agents, we helped a lot for us to be able to get moving with regards to the process. And the need for government leadership was already highlighted right from the beginning, because as soon as we started the process of waste management planning within the country, we realized that there was money from the bank and also money from the Global Fund. And we agreed that the resources needed to be pulled from one point so that we would have value for money and ensuring that we were not duplicating activities. And then obviously we're going to, we have done a lot of actions, which I'm going to summarize in the next slide. Next slide. So what we did was with the LTA we had with Crown agents, we actually had to set up a national task force. With the setting up of the national task force, we engaged the different states with the leadership of the federal government. I think earlier on, Ranjit mentioned the fact that we normally work addressing Somalia and Somaliland. And with this particular brief I'm giving you is mainly for Somalia, where we have moved ahead with most of the activities. And then after setting up the national task force, basically identifying who is already working on waste management in the different states, we found the people in the WASH section were the main people that were already dealing with waste management, and a few individuals who were on quality control within different departments within health service delivery within institutions. Then we came up with an agreement on the terms of reference for the task force. And then the next area that we looked at was the development of the roadmap and also the training of the teams on waste management. Next slide. So the task force for Somalia, as I've indicated, it had to come from the different departments, from service delivery within health institutions, as well as the WASH section within the health institutions. And in some of the states, they actually managed to give members of the task force came from the Ministry of Environment. So we got a draft set of terms of reference, which we shared with government so that they would actually be able to see whether it is relevant for Somalia. And I basically outlined this as providing a steering for the function for the different partners. As it's just been highlighted now, the need to engage the different partners. And for different states in Somalia, there are different partners who are actually working in waste management. And then the need for liaison with different government agencies who are different. We have got different roles in terms of waste management, and also the different gatekeepers that we have got in terms of waste management. And then also the task, the terms of reference also is to liaise with government and also potential donors and funders on securing funding, and also that there is an annual national and state level logistics plans for transportation, destruction and disposal of healthcare waste. And then they played a very critical role in the endorsement of technologies suitable in the country, especially as we were proceeding to procure technology under the Global Fund. Next slide. I think this is basically the detail of the terms of reference of the task force. I just wanted to highlight the need for them to supervise the implementation of the 10-year roadmap with guidance from their leadership in the different states. Next slide. So why were we doing this in Somalia? Why were we having a task force? Why were we doing a 10-year roadmap? Why were we engaging on waste management? We were engaging in waste management in Somalia because it was already envisaged as a gap because of C-19. But we needed first as an entry point to conduct the assessment. So within the assessment, we actually had the federal government states taking part and ensuring that they are able to allow us to visit the different health facilities to ensure that we have got access to be able to see what is the waste, how is it kept, how is it disposed of, and this information was not collected randomly. Crown agents had a consultant leading the process, and we used the rapid assessment tool from WHO to do this, and the assessors were trained by Crown agents on how to do the work, and the task force assisted in ensuring that the access would be guaranteed within the different health facilities. And one thing that was very important for us to get started was to appreciate that the assessment needed to be done in the different levels of the health service delivery, from community level all the way to referral facilities, so that we would have a fair view of where the waste was coming from and how it is managed within the country. So the assessment was based on, as I've indicated, on the internationally acknowledged rapid assessment tool of WHO, which was adapted for the country. And the tool was also shared with the task force and the leadership of the ministry to be sure that they are clear of what will be collected. And the information that was collected on a sample of the facilities is now kept within the ministry and is now being used for references. And one of the things that is being used for is the development of the 10-year roadmap for Somalia. And the key findings are owned by the government, and we will be in a position to share this upon request. Next slide, please. So you might be wondering now, we are talking about the 10-year roadmap. What were the key findings? I've highlighted that the findings are owned by government, and basically for us to be able to share these, we need a clearance from them. But I can safely say that waste management in the country is challenged, from regulations to disposal, to budget for waste management, to the data for waste management, and including understanding and appreciating the volume of the waste that is generated within the country. So the next step for Somalia was to develop a 10-year roadmap, of which we have it has been split into 3 sections, which is like the first 12 months, and then the next following 2 years, and then the last 7 years, which basically is talking to the different aspects of the challenges which Somalia is facing. I can go through the first action points for the first 12 months, because these are like key for the country to actually appreciate that waste is an issue that needs to be addressed as part of primary health care. Waste is an issue for quality health services, and waste can actually be an area of major investment, and partners need to be aware that it is critical for all the reasons that were mentioned by the partners that spoke at the beginning. So just to highlight that In the first 12 months, we are looking in Somalia to make sure that we do have a focal person to ensure that the country appreciates the need for healthcare waste management at each and every state level. And then we have already established the task force, which we have set up with the support from our Crown agents. And the mandate is clear of what they're supposed to be doing. And we also have got a training program for the country. We have done a trainer of trainers already. And now what we need to be able to do is to roll out the training to the rest of the staff and within the community on how best to manage healthcare waste in the country. And upgrade, the next one is upgrade on-site health facility disposal, because what we observed is right at the health facility, just the collection of the waste and disposal before you even think of recycling and all those things, it's already challenged. So there's need for us to upgrade the disposal while it sits at the health facility, or even if it means to be transported to where it can be disposed. And then there is need for a detailed waste composition and quantifications at the selected health facilities, and for each and every health facility to be able to conduct a self-assessment with a centralized reporting. This is key because just like service delivery at a health facility, waste management also needs to be understood and appreciated by the people who are working at a health facility. So we are encouraging our health facilities to be able to do a self-assessment and appreciate what it is that they are dealing with and how they can then approach our leadership to be able to be assisted with resources, with a plan of how to actually dispose of these. Then obviously they need to procure new waste management plans for key hospitals. Like I've indicated, we already had budget from Global Fund as well as the bank to be able to invest on some technologies, which we are going to be procuring in the coming year. And then upgrading of incinerators where they are applicable and can still be actually be upgraded and be used. And then develop waste collection logistics and systems. This is like the action for the first 12 months, of which some of the actions we have already started doing, and some of it will actually come as we get into the second year and third year of implementation. Suffice to say that there is need for continuous monitoring, a regulatory framework, and economic incentives are needed to steer the sector into the desired direction. Next slide. Right. In terms of purchasing of the relevant technologies and considerations, we have been getting guidance from our HQ. Thank you to Isabel and Ranjit, who have been working with us as a country. And also we have been working and making use of our colleagues in the World Bank, especially to appreciate the necessary environmental and social safeguards that are necessary for the equipment that we are going to be procuring. And also the country has made a decision on the technology that they would want to procure. This is important because the contexts differ from one country to another. Ranjit was giving the context of Botswana, which is very different from Somalia. Here we don't have electricity in most of our health facilities, and maybe the flow of water might not be the same as that in Botswana. So those issues actually were taken into consideration as we made the decision on which technology to take into the procurement process. And then we also had the access to the different technologies which are available, of which we settled for specific one for Somalia. Next slide. The major issue for us that we were looking at is we need to make sure that the waste is actually disinfected it is reduced and we are able to recycle it. The major issue that we found with recycling was where you would see that what you have got at the end product of the waste management is actually recyclable, or it can be used. We are not finding what we can use it for. The recommendations, you find they're interesting, but there is no industry in Somalia which can actually take this up and make use of it. Whereas in other countries, they're actually being able to take over and make use of the waste that is no longer infectious, that has been reduced, and they are being able to formulate it and maybe use it into making benches, which might be used in our health institutions. But we haven't come this far with regards to that in Somalia. Next slide. What have we learned as Somalia? In this process, which started almost like an ad hoc project, considering that COVID-19 was an emergency. We have learned that waste management is critical for quality health services, and also waste has been on the increase in most of our health facilities, and it is critical for us to be able to ensure that for primary health care, especially in Somalia, we are able to do this. And just to hasten to add that when we did our assessment, we didn't include the private sector, and the private sector plays an important role in this country. So for those who would want to do this and they've got similar setups, it will be important to include the private sector, because it is necessary, because the waste will still affect all of us at the end of the day. It is important for us. The second lesson that we had is that government participation is critical for sustainability, because they are running the public health institutions. They need to appreciate that for better health services, waste needs to be managed. So government participation is critical. And then the roadmap needs to be endorsed at the highest level to ensure follow-up and implementation. This cannot be overemphasized, because half the time you have to bring back everyone back to the 10-year roadmap. We agreed to do this, so where are we now? And then the technologies and choices need to have already mentioned this, that this is influenced by what exactly pertains on the ground, and it is important to understand what is required. Our major lesson here was, as we are talking to the budget for the technologies, some of the technologies cannot withstand the temperatures in Somalia, so they will be needing housing. So that's additional budget that we need to be thinking of as we move forward. Somalia is actually now proceeding with the conclusions on procurement of the technologies that we have settled for. But just to hasten and add, as I conclude, the issue of sustainability and running costs remains something that needs to be addressed. We are flagging this to Gavi, to the bank, to Global Fund, that whilst we are talking about this in Somalia, whoever is touching waste management needs to appreciate that the incinerators that we had before were used at 50% capacity, because there was no energy to burn, or the technology has changed. And the people there who are supposed to be working are sustained and paid for. Those are the kind of challenges or issues that we are having to face as we now look at the moving in of the technology into the country. Otherwise, thank you for the opportunity to share the experiences of Somalia. Thank you.
Thank you so much, Patricia. And thank you so much. I think this slide in particular is so useful in summarizing what you've stated here and thinking about waste as a consideration for primary healthcare, and just so interesting how COVID triggered you all into this series of activities, and excited to hear where Somalia goes from here. So we'll have a few moments for questions at the very end, but I do want to now quickly pass on to Mwenge Mawenge, who is the Senior Manager for System Design and Integration at Gavi and has been involved in helping drive this healthcare waste management effort over the last several years and formerly with WHO. So Mwenge, over to you to talk about specifically guidance for proposal planning, the document that you all have put together at Gavi and the maturity modeling.
Thank you, Lindsay, and good morning, good afternoon, everyone. I think, as you rightly put it, my name is Mwenge from Gavi, and I would be happy to have this opportunity to present to you the maturity model that we have developed as Gavi for countries and partners to use in trying to guide the planning of their proposals wherever they want to send them. Thank you. Next step. Next. So basically, as mentioned earlier, we have an immunization supply chain strategy, and this strategy was developed by Gavi and the alliance partners, UNICEF, WHO, and other partners as well. So we try to link the healthcare waste management to the immunization supply chain strategy. And as you know, the immunization supply chain strategy highlights the importance of healthcare waste. And this is really a growing concern, not only in immunization, but across all areas of where healthcare waste, where healthcare waste is generated. And we know also that despite most countries having adopted WHO standards, we notice that this is not really strictly followed. We still see some lapses in terms of adhering to these principles of healthcare waste management. And we also know that this is a growing concern, and it continues to pose danger into our societies in the place of work that our staff are working in. So hence, this is being taken as a priority in terms of the investment areas that we are focusing on. As you can see, there are 6 different investment areas, and healthcare waste management is one of the priorities. Next. So we have some common barriers and challenges. As explained, I think we've heard from different speakers who have come up to say there are some barriers, there's some challenges in managing healthcare waste. Some of these are, as you have mentioned before, constrained financial resources, the complicated change management, and the new equipment that has been there, even the old equipment, like the previous speaker talked about, that they've used incinerators at 50%. So these are some of the challenges that we are facing. We also know that there's limited awareness on the knowledge and best practices on healthcare waste management. Obsolete technologies, of course, as mentioned earlier, support supervision is lacking in healthcare waste management. So we need to see how we overcome this. How do we manage shops during campaigns? And this is really also more to the disposal. And we have some missing links to a systematic approach across all sectors for healthcare waste management. And this has been talked about. So we need to see how we make sure that these links work and we don't really fall into the trap of working in silos. Next. So when we look at healthcare waste management, there are 3 main areas, and these are people, processes, and technology. And how healthcare waste must be considered from a systems perspective. This is very important. We need to use a broad approach to leverage all the resources that are available, all the technologies that are available, and capacities across different ministries. Now, you're talking about Ministry of Health, Ministry of Environment, you're talking about the Ministry of Finance to ensure sustainability. Now, under the people aspect, we're looking at how do you identify the people that you're going to work with? What are the core competences? Are they well trained? Do we have all the resources that are needed to train all this staff? Then also you look at the processes, such as, do we have national policies? The budget, very important. And what will be the guidance on this? All these issues, if you remember, they've been talked about, but we just have to package them in a nice way that we don't miss any other important aspect. And finally, we've seen the different technologies that have been around, and I'll not talk much about it because this will come later in the series. But the most important thing is that we need to identify the technologies that are available currently and how can we actually use this. Next slide. So having mentioned the three main areas, there are some 6 sub-areas to assess the maturity level of the healthcare waste management system. So under the people area, we have 2 sub-areas, and this talks about awareness, training, and supportive supervision. And then we also talk about how the adherence is done, how is the compliance by the people who are tasked with managing waste. Then under the processes, we're talking about, do we have national policies, we have strategic plans, budget and planning? Is there some practical guidance that can help in this area? Then we also have, under the technology, what technology and equipment is available for use. So once we look at all these areas, it helps us to better plan and assess our maturity level that the country falls in. Next. So the maturity modeling, how do we go about it? We have to identify high-level gaps and potential opportunities. And by this, we have a tool with questions that would facilitate stakeholder engagement in planning for healthcare waste management. So here we look at about 6 different steps. So you review any recent assessments that could be training records, audit, or supervision reports. And we also need to estimate waste quantities across all health areas. Ranjit mentioned about some of the tools that they used in conducting the assessments. So this is one of them, very important that we estimate the waste that is generated. We look at also the high-level update of inventory of treatment and disposal equipment. Thereafter, we also look at what's the landscape of the private sector companies involved in waste management. This is important to see how we can actually leverage their presence. Also, we need to ensure that the financial resources and opportunities for investments are solid. How do we ensure that these are available? How to map all the partners that are working in this, even in other ministries, so that we do not duplicate our efforts with the limited resources that we have. And also, we have to prioritize the most immediate needs of what the people need, what are the processes, what technologies, and identify long-term strategic planning needs. All this will build on the maturity model and system ranking. Next. So, and the assessment tool really will be used now to rank now. This needs a lot of participatory participation from stakeholders who are involved in healthcare waste management. And this should be guided by assessments, as I talked about earlier on reports and understanding of the context. And as you can see in this slide, that we have to rank all the people, processes, and technology, and looking at all those sub areas, and then you score them, and whatever you get, you divide by 6 to get the overall score. Next, I'll show you an example of how we worked on this. So after you do the ranking now, this is an example of the maturity assessment that was done in 25 African countries. So as you can see, we have a list of countries, and this is a summary. So we look at the people, processes, and technologies. And as you can see, the major gaps were really across all the categories of people, processes, and technology. Practical guidance, if you look at it, is highest and budgeting is lowest. So what does this tell us? This shows that probably there is a lot of guidance that is available and it has not been put into practical use as seen in these results. So this could be because maybe of the low budget allocation and planning associated to this. So this slide tells us where we should put our interventions, where we should focus. Next slide. Right. So we have some recommended steps for designing and implementing healthcare waste systems. As I mentioned earlier, we conduct a high-level strategic assessment, and then we look at what proposals we have. Is it a full portfolio planning? Is it health system strengthening proposals? And this is mainly relating to Gavi. Or indeed, we're looking at other investors or other partners who want to support this. So we plan for immediate actions to address common barriers. And we ensure that we design and plan the systems to reinforce knowledge and best practices. So whichever proposals you want to do, I think it can go beyond what I've mentioned in terms of some of the Gavi proposals. You can look at what the Global Fund is putting up, or what the World Bank is putting across, or UNICEF or WHO, or indeed the Africa CDC. But you use the same concept, it will help you to arrive at some of the high-level areas that you need to focus on. And then we need to identify and engage key stakeholders. This should go beyond the immunization sector. And then we need also to consider the preferred technology and equipment, as mentioned earlier. Lastly, but not the least, but also we need to identify opportunities for other forms of investments and collaboration across sectors. I think we need to look at all the sectors that can really help us in establishing a proper healthcare waste management system. Next slide. Now, we have some opportunities for funding from different agencies. This was really arrived at after the meeting that we had in Addis Ababa, where we met all the stakeholders, and they highlighted some of the areas where potentially governments could tap in to actually consider applying for some funding. As for Gavi, we're looking at the full portfolio planning, and this includes the health system strengthening grants, the equity accelerator funds, and also any other partners that would be associated with this. UNICEF also has some of those highlighted. They've been doing some work on situation analysis and assessment, technical assistance in partnership with Gavi. We have some funding that has been associated with this. Africa CDC also, I think they have different areas where they could provide that. WHO and indeed the Global Fund. So we have a wide area of possible funding. What we need to do is to map these needs together, align, and make sure that we work as one. I fully understand that sometimes in countries we could have the Minister of Health working alone, Minister of the Environment working alone, but it's very important that we come together, put our proposals together, and put our needs so that we leverage on the limited resources that we have. So this is the brief description on how you could actually conduct a maturity assessment and potentially tap into available funding. Thank you.
Thank you so much, Mwenge. And that brings us to the end of our presentations. So great to see the various work that's been going on. I'm going to ask my presenters to turn on their cameras, Ranjit, Patricia, Mwenge, Isabel. We have one question we're going to ask all of you. It is a rapid response question. You have no more than 30 seconds to respond here at the end. So Sophie, could you give the question to our panelists?
Absolutely. All right. How can national actions take sustainability into consideration? What guidance could you give to keep sustainability at the forefront during all of the activities mentioned, from planning to assessments to trainings?
Patricia, you're off mute, so I'm going to go to you first. Patricia.
Thank you very much. I would say the first thing is government accountabilities need to be on the forefront, because we are dealing with communities, we are dealing with public institutions. Let's have the government in the driving seat, make them accountable for waste management. They can get support from all the partners, but they need to be in the driving seat for these processes. Thank you.
Thank you, Patricia. Ranjit, over to you.
Totally agree with Patricia. Accountability is the first thing that needs to happen. And then when we plan our interventions, not just for CAPEX, not just for today, it has to be over a long period of time, and including operations and maintenance into consideration.
Wonderful. Thank you. Mwenge.
Well, I think I'll summarize kind of, but most importantly, I think if you look at our CapEx, operation and maintenance and all these things, what we need is to make sure that we put our resources together, make sure that the Minister of Health, Minister of Environment, put their needs together, make one plan. And also this goes to the partners to come together and collaborate in terms of support. However, the Minister of Finance is very important to help to plan for future financing expenditures to sustain the whole system, which has to be government-led.
Fantastic. Thank you. And Isabel, you get the final word.
Yeah, those were all good answers. But I would say, everything starts with an assessment. Start with an assessment, find, your weaknesses, and then you'll be able to work out a long-term plan, working on a 10 years period. Then you go to the Ministry of Health, you go Ministry of Finance, Ministry of Environment, and they will see that you have something that is structured, that you know where you're going for the long term. And then with them, you'll be able to set up a budget so that it's sustainable.
Wonderful. Thank you all so much for all the presentations, for all this really informative information on healthcare waste management and the national actions, from looking at assessments and situation analyses to maturity models, and really the full picture of how we start this process to actually coming up with a work plan and a roadmap in order to drive forward 0 to 10 years. And thank you so much to Somalia for really being able to help illustrate that in a country example. We are closing up here, and apologies for going 2 minutes after, but just to share, this is the first in a 3-part webinar series. The second and third sessions will take place in the beginning of 2024. Join us on Tuesday, January 23rd for a session on green and safe technologies for healthcare waste management, from selection and procurement to implementation. And in February, on February 20th, we'll have a session on facility level activities managing healthcare waste, with a particular focus on those capacity building components. Again, thank you so much to our partner Gavi, and to Africa CDC, and to the Global Fund for joining us, and to you all. We had over 100 folks today. Really fantastic to see this enthusiasm around healthcare waste. So thank you all. We'll see you again in the new year. Happy New Year to all, and take care.
Thank you.
Thank you for organizing, Linz. Bye.
Bye.
Thank you, everyone.